University of Arizona's Dr. Farshad Marvasti told CNBC on Thursday that wearing a face mask is part of our civic duty to help prevent the spread of the coronavirus. One reason for Arizona's recent rise in COVID-19 cases and hospitalizations is that many people in the state are not wearing masks, Marvasti said on Power Lunch. Most folks have been out and about in closed spaces, including nightclubs, bars, malls, restaurants, without any mask wearing, and I think that's a big contributor to what's going on, Marvasti said. This idea that we can just kind of go back to normal prematurely has been a big issue. Daily cases in Arizona have been rising in the last 2 weeks at a pace that exceeds increased testing capacity, Marvasti said. On Wednesday, it reported 296 new cases of COVID-19, according to the Arizona Department of Health Services. Its largest daily case increase came on June 4, when 663 new infections were reported. The percent of positive test results has risen from about 5% more than a month ago to between 11% and 13% in the last week, depending on which one of the models you're looking at, said Mavasti, Director of Public Health, Prevention and Health Promotion at the University of Arizona's College of Medicine Phoenix. Marvasti also pointed to rising hospitalization rates. Wednesday was the state's 10th straight day with more than 1,000 people hospitalized with COVID-19, the Arizona Republic reported. Banner Health, the state's largest health care system, told CNBC on Monday that its number of COVID-19 patients on ventilators has quadrupled since May 15. All of these trends kind of come together to point to it being more than just testing and really because of extensive community spread, Marvasti said. There are concerns about intensifying COVID-19 outbreaks in other states, too, such as Texas and Florida. Arizona Governor Doug Ducey's stay-at-home order went into effect March 31 and expired May 15, after a roughly 2-week extension. Non-essential businesses were able to reopen earlier in the month, provided they could follow certain social distancing guidelines. Dine-in service at restaurants resumed May 11. Marvasti said Arizona did not necessarily reopen its economy too soon, arguing that its lockdown was effective in containing the virus. For example, there were 351 new confirmed cases of COVID-19 on the day Arizona's stay-at-home order lapsed. It's not a question of whether we should have reopened when we did or not. It's how we did in terms of the behavior of individuals, Marvasti said. He said that wearing a face covering was beneficial for both the person wearing it and those around them. The Centers for Disease Control and Prevention recommends wearing a face covering in public. Marvasti said he did not believe Arizona would need to implement another lockdown if cases continue to rise, but suggested that how the economy remains open may have to change, such as which businesses can operate.